Common causes of prolonged menstrual bleeding.
In this video, we will discuss the common causes of prolonged menstrual bleeding, also known as menorrhagia. Menorrhagia is a condition in which a woman experiences abnormally heavy or prolonged menstrual bleeding.
What is considered prolonged menstrual bleeding?
Prolonged menstrual bleeding is when a woman's period lasts longer than 7 days or when she experiences excessive blood loss, more than 80 milliliters per menstrual cycle. This can be caused by various factors, which we will explore in this video.
What are the hormonal causes of prolonged menstrual bleeding?
Hormonal imbalances are a common cause of menorrhagia. These imbalances can be due to polycystic ovary syndrome, PCOS, a hormonal disorder causing enlarged ovaries with small cysts on the outer edges. Thyroid problems. Both hyperthyroidism and hypothyroidism can lead to prolonged menstrual bleeding. Estrogen and progesterone imbalance. These two hormones regulate the menstrual cycle. An imbalance can cause the endometrium to overgrow, leading to heavy bleeding.
What are the structural causes of prolonged menstrual bleeding?
Structural abnormalities in the uterus can also cause menorrhagia. These include uterine fibroids, non-cancerous growths in the uterus that can cause heavy bleeding. Uterine polyps, benign growths on the endometrium that can lead to prolonged bleeding. Adenomyosis, a condition in which the endometrial tissue grows into the muscular walls of the uterus, causing heavy and painful periods. Cervical or endometrial polyps, non-cancerous growths on the cervix or endometrium that can cause heavy bleeding.
What other factors can contribute to prolonged menstrual bleeding?
Other factors that can contribute to menorrhagia include use of certain medications. Blood thinners, anti-inflammatory medications, and hormonal medications can all cause heavy bleeding. Intrauterine device, IUD, non-hormonal IUDs can sometimes cause heavy and prolonged periods. Bleeding disorders. Conditions such as von Willebrand disease or platelet dysfunction can cause excessive menstrual bleeding. Cancer. Uterine, cervical, or endometrial cancer can also cause abnormal bleeding. There are several common causes of prolonged menstrual bleeding, including hormonal imbalances, structural abnormalities, and other factors. If you are experiencing menorrhagia, it is important to consult with a healthcare professional to determine the underlying cause and receive appropriate treatment.